Thank you all for coming. We're here at Dunkin Donuts Ballpark, Yard Goats Park, to hold a vaccine clinic for our community here in Hartford. And I want to say thank you to all of the people who helped this come together and who are working on a daily basis to vaccinate residents in our community. But I want to share a number of things before that. First of all, I think everybody knows that we are still in the early stages of this vaccination effort. Right now, eligibility is still limited. It's limited to that group in 1A, which included healthcare workers, folks who are in congregate settings, nursing homes, and now it also includes those who are over 75. We expect that soon, in the coming weeks, it'll expand to include those who are over 65 and others who may have underlying health conditions and frontline workers. But right now, the ones who are eligible to be vaccinated are those who are first responders, healthcare workers, or in congregate care settings, or senior residents over 75. And that's where we're really targeting our outreach right now, because we want everybody in our community who is most vulnerable to this disease to get the vaccination. And like with testing, that's a team effort. And we're lucky in this city to have a phenomenal team, a team that includes our outstanding hospitals, Hartford Healthcare, as well as St. Francis Trinity Health in New England, and outstanding federally qualified health centers that have been key partners in getting tests out into the community, as well as our own health department. Those same partners are working night and day on this vaccination effort, and I'm hugely grateful to all of them. I want to share a little bit about how you can get the vaccine, how you can get an appointment for a vaccine, because it's important for everybody to know just how to do it. The easiest way, if you are online, is to go to the state's website at ct.gov/COVID vaccine, and you can look up the location of the nearest vaccine clinic and make an appointment. You can also call the lines direct to our hospitals, and those are online. But what I want to share with you today is what we're doing as a city to try to make it as easy as possible. And it's two big things. One, if you go to our city website, which is hartfordct.gov, that's hartfordct.gov, there is a vaccine interest form right at the top of the website. It's very simple. It's very easy. There's not a lot of information required. If you fill that out, either for yourself or for somebody else, we will proactively reach out and make contact and help you or your loved one or neighbor or whoever you're helping get an appointment and get that vaccine. The other thing you can do is call our line, our phone line, at 860-757-4830. It's 860-757-4830 to make an appointment with our health department. But again, I want to make sure people know there's a bunch of different ways that you can make those appointments. I also want to stress that the state has done a tremendous job of ramping up their own capacity and the number of call operators who are taking calls at the state's phone line, and the wait time is very short, and it's easy to do it that way too. So lots of ways to do it, lots of partners who are administering the vaccines. That's how it should be. That's how we're going to get everybody vaccinated. But this clinic that we're holding here at Dunkin Donuts Park is one piece of the puzzle here in Hartford. It's not the only piece. Again, our hospitals are doing tremendous work and having daily clinics. One of our FQHCs, Charter Oak Health Center, is holding a walk-up vaccine clinic as we speak over on Grand Street. And all of those partners are out doing work every day. This one is administered by our city health department in partnership with the state and, of course, a number of others who I will mention. And we wanted to do it here for a bunch of reasons. One, it's a well-known spot. It's easy to get to. It's on the bus line. There's easy parking. And we've got room to move a lot of folks through and get vaccines. We will be administering hundreds of vaccines today at this clinic. We're going to try to do this here on a weekly basis, every Saturday. But again, that's not all we're doing. We're also going to be going out to apartment buildings where we've got a lot of seniors, trying to bring the vaccine to people, meet people where they are, make it easy in every way we can. But we do think that having a central location like this makes a lot of sense. I have a number of thank yous to make, but I think what I'll do is make those along the way as I introduce folks who are going to make some remarks. And first and foremost, I'm so grateful and so proud to have with us our state's senior United States Senator, Dick Blumenthal, who has been a tireless advocate for us down in Washington, who has been fighting since day one of this pandemic for the federal government to get in the game in a big way. Fighting for resources for small businesses, resources for testing, for vaccinations, and we're so grateful to him for the work that he's done. And as we well know, there's an effort right now to pass a relief package that includes substantial resources to bring this effort up to the level it should be. And our senator, and along with our Senator Blumenthal, along with Senator Murphy, have been right in the middle of that battle fighting for Connecticut. So with a lot of gratitude, I'm going to ask Senator Blumenthal to come say a few words.
Thank you, Mayor Bronin. Thanks for your leadership. We're here today because you are really all in, and Hartford is providing a model. And I want to thank the Yard Goats, the St. Joe's pharmacy students. Thank you to the students who are here learning on the job, but also doing great service. And to Director Arroyo, I was with her just yesterday, and to the Hartford Fire Service. Everybody's all in on this effort. And beginning with the United States Congress, I hope, which yesterday at 5:30 in the morning, after about 15 hours of nonstop debate all through the night, approved the American Rescue Plan blueprint. This blueprint provides about $160 billion for exactly this kind of outreach. And let me be very blunt. The only way we win this battle is by outreach and vaccination. If people don't get the vaccine in their arm, they're simply not going to be protected, nor are their families or neighbors or the country. And that's why we included in that package a specific provision that says you have to reach out, educate, launch a campaign. Literally, a public awareness campaign. So we get more folks into every clinic, every healthcare center, and every ballpark that's willing to do what we are here. Everybody who comes here hits a home run. Everybody who comes here to get vaccinated is a home run hitter, because they are protected, and they protect their families, their neighbors, their co-workers. It's a win-win. You can't lose by coming here. So I want to focus on a sort of difficult truth. In the rollout of the vaccine, only about 5% of the people who received it were African Americans. 60% were white. 11% were Latino. This kind of disparity is a disgrace. The disparate distribution is intolerable. We need to bring everybody into these facilities, because it is the only way we can conquer this pandemic. I understand some folks are going to be hesitant. Understandable and reasonable that people should question. But there are answers. Safety and efficacy have been clinically tested and verified. Let me just repeat. This vaccine is safe, it's effective. Some people may have some doubts, but there are answers. And that's the public awareness campaign that we are fostering throughout the country. Now, Connecticut is at the forefront of the nation with a 10% vaccination rate. But that's nowhere good enough. We need to make more of it and make it more available. And that $160 billion is part of the national effort that we need to do, and it will bring hundreds of millions of dollars to Connecticut. As part of the National American Rescue Plan, hundreds of millions of dollars will come to Connecticut so we can vaccinate everyone. And we need to do it as quickly as possible. So let me just conclude by saying that we are in the midst of the greatest national crisis in our lifetime. It affects every facet of our life, and it affects everybody in this great country. We need the full $1.9 trillion to dig our economy out of the ditch it is presently in. We need that money to put people back to work, but we also need it to overcome the public health crisis that we face. Vaccines, testing, and yes, continue to wear the mask even when you get vaccinated, and social distance, physically distance, hand washing, all of these precautions. And this kind of massive national effort is what is necessary right now to conquer this vaccine. I'm going to be going back to Washington, and we are working right now. Literally, we are moving forward, even as we do the impeachment trial this week. I want to assure you, we are working with Republican colleagues. We're trying to make it bipartisan, and anyone who wants to be a part of it is welcome, no matter what their party. Republicans are invited to the table. There's no price of admission, but we need to move forward with this massive program right now. And the greatest, I'm going to be taking this photo. You know the old saying, a picture's worth 1,000 words? I'm taking this photo with me down to Washington to tell my colleagues, here's how it's done. And of all the events I've attended here, ball games, immigration services, all kinds of private events, this one is probably the most inspiring, because we're really saving lives. If you come here for a vaccine, you're saving lives. So thanks to everyone.
Thank you so much, Senator Blumenthal, for everything you're doing for us down in Washington. Now, as Senator Blumenthal just said, there's a lot that happens here at the ballpark. Of course, in normal years, we get baseball. We get a lot of community events right here. We get immigration naturalization ceremonies, as the senator mentioned. And so I always wear my Yard Goats gear with pride, but never more proud to wear this gear than today, because I'm so grateful for the partnership of the Yard Goats team, Tim Restall, and the entire team here for making this possible. So without further ado, Tim, over to you.
Thanks, Mayor. And thank you for all your leadership during this time. And Senator Blumenthal, thank you for your leadership in Washington. We often say that, you know, the Yard Goats is more than baseball, and this past year is a true definition of more than baseball. We've held Turkey Tuesday here. We've done Red Cross blood drives, and today we're doing vaccinations. Like baseball, it's a team sport, so I want to thank everyone from the city of Hartford, the mayor's office, to the health department, to the police department, the fire department, DPW. It takes a team like it does in baseball. So that being said, we'll put it into a little baseball analogy that, you know what, today, everyone, like Senator Blumenthal said, everyone's hitting a home run. And if you look at the scoreboard, someone's taking the lead, and it's Hartford. So thank you guys for coming out today.
Thanks again, Tim, and thanks to the entire Yard Goats team here for helping to make this happen. As I mentioned, we have lots of partners who are working with us. One of the partners that is critical to this effort today is University of St. Joseph's, because their students from their School of Nursing are here helping to administer these vaccines and make this possible today. And That's the kind of partnership that we value so much and that's been so critical at every stage of battling this pandemic together. And so I cannot say thank you enough to Rona Free, the president of St. Joe's, for joining us today and for everything that the St. Joe's team is doing to help out.
Well, thank you very much, Mayor. I also want to thank Senator Blumenthal for all that he's done to provide relief to the state, and especially to higher ed. Higher ed has faced a lot of challenges in this COVID, but we play a critical role in preparing the healthcare workers, like the ones who are here today, our St. Joseph School of Pharmacy students administering vaccines. With our School of Pharmacy in downtown Hartford, we're really grateful to the city, to the residents, to the businesses that have been so good to the university and our students over the last few years. So we're glad to do a little bit of our part to be here in this kickoff event today. Like everyone else who's here, we realize how critical it is to have the community vaccinated as quickly as possible. And so we're delighted that we have our pharmacy students and our pharmacy faculty here today to help out. One of our core values is that we prepare students to go out to serve the needs of their community, whether it's in their careers or as citizens. And so this type of experience is an integral part of all of our educational programs. And so we've had dozens of students of nursing, of pharmacy, out in clinics across the state in the testing process and now in the vaccination process. So at this point, we look forward to sending out more students, more faculty, helping with the research that ensures that in the next pandemic, we're well prepared to take care of our population. And we're just very grateful to be a part of this effort in the state where our alumni, our students, and our faculty live and work. Thank you.
Thank you so much, Rona. Again, thank you to the University of St. Joseph, and thank you to all of the pharmacy school students who are here. It's a great partnership. I want to acknowledge our City Council Majority Leader, T.J. Clark, who I know is here. I think he didn't want to speak, but he's here, and I want to acknowledge him. He wears two hats, not just Majority Leader, but also has been central to Charter Oak Healthcare's outreach efforts as well. You've seen this team, I think, in a lot of different forums of Chief Freeman, Leonie Arroyo, Voss, my Chief of Staff, Thea, our COO, who are working constantly together. But I'd like to ask Chief Freeman to come up and just say a few words about this vaccine and about how important it is for everybody in our community to get it.
Thank you, Mr. Mayor, and greetings to everyone. Thank you to all of our partners, Senator Blumenthal, for everything he does for us in D.C., our partners at St. Joseph. This vaccination, it is truly something that we all have to commit to getting. For our 353 firefighters, we are well into the triple digits of our firefighters voluntarily receiving this ever so important vaccination. That's important for the simple reason of we provide critical services to our city where we don't just respond to fires. Out of our 30,469 calls for service in 2020, just under 21,000 were EMS calls. And so we enter our citizens' homes. It's pertinent that we wear our PPE. It's pertinent that we are vaccinated to not only protect ourselves, but also to protect our citizens. We have had 2 firefighters hospitalized due to COVID-19 complications. So I'm very proud of the fact that our Hartford firefighters, your Hartford firefighters, are stepping up and getting the vaccine, as well as our brothers and sisters in the Hartford Police Department. A number of our officers have voluntarily received the vaccination as well. So if you don't do it for yourself, please do it for your friends, please do it for your family, and please do it for your neighbors. Thank you.
Thank you so much, Chief Freeman. And now, last but certainly not least, I'm going to ask our Director of Health and Human Services, Leonie Arroyo, to come say a few words. Leonie and her team have been working literally around the clock to get the word out, to help educate our community, to reach out directly by phone to seniors throughout Hartford, manning the phone lines when folks call in, sending letters out, and making clinics like this possible, both at our health department on a more regular basis and the bigger clinics like this here at Dunkin Donuts Park. And so I want to say a big thank you to Liani, but I also just want to call out a few folks on her team. This is not exhaustive. They've got a big team that's working hard and working together. But I want to say a huge thank you to Monique, to Faith, to Toon, to Nancy, and to Sita, who have really been the engine behind getting this site up and running. And so, Liani, thank you to you and everybody on your team for everything you're doing every single day.
Thank you, Mayor, and thank you, everyone. It truly is a pleasure to be here, and I'm so very grateful to Tim and the Yard Goats for being so quick to say yes and being so quick to commit to a number of weeks of us being here. Our team has worked very, very hard to ensure that our residents here in the city of Hartford, whether they can use a computer or have access to technology, whether they have transportation, whether they speak English or not, have access to this life-saving vaccine. And we couldn't have done this without the support of the mayor and his team and staff, and I feel very, very lucky to work here in the city of Hartford for our mayor and the wonderful team that he has assembled. It truly is a team effort. Our work in doing this was to ensure that those seniors who are at risk of being left behind are not being left behind. And what we've seen today has been truly amazing. Folks are talking about vaccine hesitancy, and we know that it exists, but our seniors want this vaccine. They want to get here, and we're working to make that happen. I want to say a few words in Spanish to our Spanish-speaking community. Le quiero dar las gracias a nuestro alcalde Bronin y el equipo que él ha construido aquí en la ciudad de Hartford, y también al equipo de los Yard Goats por trabajar con nosotros. Y también a nuestros legisladores federales como el senador Blumenthal, que siempre están aquí con nosotros mano a mano peleando por recursos para que lleguen a la comunidad. Hoy estamos aquí vacunando a esas personas que no queremos que se queden atrás. Tenemos una vacuna. Aquí en nuestra ciudad han muerto más de 250 personas y tenemos una vacuna que puede salvar vidas. Así que le pido a nuestra comunidad, por favor, si tiene 75 años de edad, llámenos al 860-757-4830. Otra vez este número es 860-757-4830. Puedes dejar un mensaje en español y dentro de 24 a 48 horas le vamos a regresar esa llamada para hacerte una cita. Si no tienes 75 años de edad en adelante, tienes 65, que esa va a ser la etapa que va a abrir ya pronto, llámenos y te ponemos en una lista para poder llamarte. No necesitas documentos, no necesitas seguranza, no necesitas transporte. Aquí estamos a la orden para ayudarnos. Hoy yo mismo me vacuné y me vacuné porque quiero estar segura que estoy dándole el amor a mi comunidad y a mi familia. Así que por favor, cuando tengan la oportunidad, vacúnense, porque nuestra comunidad, la comunidad latina y la comunidad afroamericana han sufrido bastante con esta pandemia, y ahora es nuestro turno de vacunarnos para no tener seguir con ese sufrimiento. Gracias.
Thank you so much, Liani, again, to you and your team for everything. Now, I'm just going to close by, again, saying thank you to all the partners who are working together, not just to make this clinic possible here at Dunkin Donuts Park today and on a weekly basis, but to everybody who's working every day to educate our community, to reach out, to help people make appointments, to administer the vaccine, again, whether it's at our hospitals, whether it's at apartment buildings, whether it's at our health department, or whether it's here, a big citywide partnership. And I also want to say a huge thank you to Governor Lamont and his administration, Josh Jabal, Michelle Gilman, who is running the vaccination efforts. They have been tremendous partners. And it's because of that partnership that we're able to do this here, and that we're able to do so much of the other work to get our vaccine out, get this vaccine out into our community. They have been working under the same constraints as everybody because of the challenges in the predictability of the supply, but they have been working tremendously to get that predictability in place to increase the supply and to work with local health departments like ours and hospital systems and others to get it out and into people's arms. And we're very fortunate to have that hand-in-hand partnership with the state of Connecticut. I talk to mayors around the country, and I can tell you that not every state and not every city can say that same thing about the tight partnership between state and local government. So we really are fortunate to have that partnership and to work together every day. With that, let me just again encourage everybody, if you are eligible for the vaccine and you haven't gotten it, sign up now. If you've got a loved one or a neighbor or a friend or a coworker who's eligible and hasn't gotten it, help them sign up. Go to our website, fill out the vaccine interest form, and we'll call you and help you through the process, or call the number and we'll help you get that appointment. Now, with that, happy to take any questions. That's right. Yep. We're not going to turn people away, but we're focused on residents in Hartford.
And how many weeks now are people
We're going to be doing it right now. We're not booking weeks ahead. We booked, we still have some appointments right now. If folks want to call the line right now, if you're watching this live and you're eligible, you call 860-757-4830. You can make an appointment and come down here before 3 o'clock. And after this is over, we'll begin making appointments for the next one. In terms of how many weeks we'll do this for, we don't know. We'll do it for as long as we have a consistent supply. We'll schedule as far out as that supply allows us to plan. And in the meantime, again, this is just one piece of the puzzle. It's not just these Saturday clinics, it's also more regular clinics at our health department on Coventry Street and at our hospitals and many others. So again, if you're eligible, reach out. If you have any trouble making that appointment, call our number and we'll help you do it.
Now, I know that you talked about people being able, if they're not able to come here, that you can come to them. Who is coming to them, and how do they get that?
Well, let me say two things, and Leonie can jump in and correct me if I mess anything up. Just like with testing, we've said from the start with testing that you don't need insurance, you don't need a prescription, you don't need to have symptoms, you don't need to pay, and if you don't have a car, we will give you a ride. That same thing is true for vaccines. So if you need an appointment and you can't get here, call us, call 311. We will give you a ride. If you schedule the appointment through us and you don't have a ride, let us know and we'll arrange for a ride. So we will help people get here to the clinic or get to our health department or get to the convention center where Hartford Healthcare is running their daily vaccination efforts, or anywhere else. We don't let the lack of a vehicle be a barrier. We will give you a ride. But in addition to that, we're also having our teams go out to apartment buildings where we've got a lot of seniors living and administering the vaccine right there. And that we're just going to do as much as we can. Again, supply depending, resources depending, staff depending. We'll do that as often as we can. And hopefully we'll be able to do even more of that in the weeks ahead as the supply continues to ramp up.
Have you been finding that people are utilizing the ride service to its fullest?
Well, I don't know if they're using it to its fullest. What I can tell you is it's available, and we encourage anybody who needs it to take advantage of it.
And just to be clear, you're having this next Saturday, but in the future you're not quite sure?
I expect that we're going to be having this on a weekly basis for the foreseeable future, but certainly next Saturday. What I'm saying is right now we have not had a need to book these weeks ahead. We took appointments this week for this one. We'll take appointments beginning Monday for next Saturday, and I expect that we'll be here on a weekly basis for the foreseeable future. But again, that's just one piece of the puzzle. There are many places where folks can get the vaccines, and we as a team will be working to help make it as easy as possible for folks to get to the quickest, easiest, most convenient appointment they can.
And I might just add, there are going to be increasing amounts of vaccine available. So we're going to need more sites like this one as the numbers of doses ramp up. Johnson & Johnson is probably going to be available within a week or two. There's a possibility of AstraZeneca. Moderna and Pfizer are increasing their capacity. The President's going to use the Defense Production Act. we're going to see massive increases in the amounts of vaccine available. And we're going to need these kinds of sites to get it out there, get into people's arms. You know, vaccine is of no use unless it becomes a vaccination. If it's not in people's arms, it doesn't help anyone. So we're going to ramp up the production, but the delivery at sites like this one has to go forward.
What's the latest number of how many people you've had today?
When I walked in, we had vaccinated 120 people. We expect that we'll do solidly over 200 by the time today's done.
Now, are you only bringing the amount of vaccine as people sign up?
We've got as I said, we're still taking appointments right now. We have enough vaccine to cover every spot that's available today. We're not going to be cutting it close.
And if there's leftover,
if there's leftover, then it will be administered at one of the clinics that we hold during the week, or one of the mobile visits that we do. So we are managing this on a very carefully. Obviously, we want to make sure that there is sufficient supply to vaccinate anybody who signed up today, and anything that we have going into next week will be administered either at our health department over on Coventry Street, or on a mobile basis at one of our apartment buildings or senior complexes, or other places where we're holding those vaccines. So no vaccine will go to waste, and we're managing it very, very carefully, and we're also working to get it out as quickly as possible. Any others? Nope, going once? Okay. Thank you so much, everybody, and to everybody out there, stay healthy, stay safe, and if you're eligible, get vaccinated. Thank you.